Hey guys, welcome back to Mental Health Matters. I'm so sorry it's been such a long time. I started a new job, did a bit of travelling and sadly kind of neglected YouTube, which is a bit of a shame. But anyways, today's video is going to be all about obsessive compulsive disorder. So I could talk about OCD literally forever. It's so interesting yet so misunderstood. But for this video, I'm just going to do a quick overview looking at the definition of OCD in the DSM, looking at some of the signs and symptoms and some of the treatments. And I might go on to talk about some of my own experiences with OCD. So without further ado, let's get on to the video. And if you would like a more in-depth detailed video of obsessive compulsive disorder, leave a like down below. So to define OCD, I'm going to split it into two chunks. One's going to be talking about the obsessions and the other one's going to be talking about the compulsions. I have got this definition from the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. So the DSM, which is basically like a psychology dictionary, kind of like the Oxford Dictionary but for psychology. So it starts with obsessions. So obsessions are reoccurrent and persistent thoughts, urges or impulses that are experienced at some time during the disturbance as intrusive and unwanted. So for example, I could have an intrusive thought and it can just be something really random. An example of it, an obsessive thought or a thought in general could be, oh, this person's really annoying, I wish I could just get rid of them. And anyone else would kind of think, oh, that was a bit mean. Oh well, I was angry at them. These things happen. I had a little bit of a bad thought. And they dust it off, carry on with their day and forget it happened. Someone with obsessive compulsive disorder would let that thought linger and give it a lot more meaning than it really should have. So they would think, does it mean I'm a bad person? Does it mean I'm actually going to do something bad to this person? Does it mean that I'm responsible for anything bad that's going to happen to this person? And they might feel increased feelings of anxiety, stress, guilt. They might feel really disgusted with the thought they've had, and because they can't let it go, this thought then becomes an obsession because they keep thinking about it, and this could lead to other similar thoughts of this nature or repeated same thoughts. So it also states that most of these obsessions will cause an individual to have anxiety or distress, and that is why people with OCD give such thoughts so much meaning, because of the physical reaction that they are getting. So for example, I could have some sort of thought that my phone has loads of germs on it and me touching my phone could then get myself ill and other people ill, and this would make my heart rate increase. I'd be really anxious, really kind of agitated and nervous, and this physiological reaction is giving my random thought about this phone more meaning than it needs to have. So then I keep going around in my head, is this really bad? Is this really bad? Oh, is it going to make people sick? When in reality it probably isn't. There are loads of germs in our atmosphere, but it probably won't make me sick. But because I have OCD, I can't let that thought go, and I have this kind of the what if thing going on, and I think, what if this, what if that, and I can't let it go, and it's given me so much anxiety. And that is where our compulsions come in, which we'll talk about later. So the second point to obsessions is that the individual attempts to ignore or suppress such thoughts or to neutralize them with some other thought or action, i.e. the compulsion. However, it just doesn't work. So you can try and forget it, but however much you try and forget it, you just can't. It's stressing you out, it's causing you so much anxiety physically that you can't forget it mentally. So I'm going to do a little exercise with you guys. This probably sounds really weird. You've probably either done it before, but I'm going to stop and not say anything for 5 seconds, and I want you not to think of a black bear. And as you can see, whilst you were trying so hard not to think of a black bear, most of you, probably the only thing you thought about was a black bear. And that is what goes through people's minds when they are trying to suppress unwanted thoughts. As you are consciously trying to suppress a thought, you are then consciously bringing it back, which kind of sucks. So another way that people with OCD deal with these thoughts is through compulsions. So the first definition of a compulsion is a repetitive behaviour, i.e. hand washing, ordering, checking, or mental acts. For example, if I count to 3, this thought will disappear, or it never happened, or praying, or repeating words. So this leads us on to talking about compulsions. So compulsions can be repetitive behaviours, i.e. hand washing, ordering things or checking things, and there are loads of different types of compulsions which I can't mention all of them in this little overview. But the individual does these because they feel driven to perform them in a response to the obsession or according to the rules that must be applied. So for example, in order for me to calm down my intrusive thought about germs and hand washing, I may have to wash my hands not only once, but 3 times so that I feel like they're properly clean. Or in order for me to feel comfortable to leave my room, I need all my shoes to be in a certain order so that I'm dealing with that intrusive thought of, oh, something bad might happen if my shoes aren't in the right order. So by dealing with that intrusive thought and by letting it go, in a sense, I will put my shoes in the right order. Now, this may feel good for the person suffering with these obsessive thoughts, but sadly it literally just creates a cycle. So you have the obsession, then you have the anxiety that comes with that intrusive obsessional thought, and then you do the compulsion to fix that, and then you have your obsessive thought again and you end up doing the compulsion again, and it's just this big vicious cycle which is really, really hard to break. So these compulsions are basically behavioural acts which are aimed to reduce the anxiety and the stress that comes with these intrusive obsessional thoughts. So as we've said, for example, someone washing their hands might do that to reduce the anxiety they feel when touching the front screen of a phone if they feel that there are germs on them. Now, anyone without OCD would dust that off, would be able to leave that thought behind and be able to carry on with their day. But someone with OCD won't be able to let that go and won't be able to cope with the anxiety and the feelings of stress that comes with having this intrusive thought. So they therefore do these compulsions to either neutralise or kind of prevent anything bad from happening. So one thing to note about these compulsions is that you don't just do it once and you carry on with your day. These compulsions are really, really time consuming. People can spend hours literally just getting ready for bed just so they can get rid of that stress and anxiety that comes with these intrusive thoughts by doing multiple compulsions before night, literally so they can get maybe 3, 4, maybe even 5 hours of sleep. It goes in one big cycle, and until people are satisfied that they are no longer anxious, which doesn't even last that long, they will carry on doing these obsessions. Okay, so there are normally 2 types of treatments to help treat OCD. Now, these are the main type of treatments. There might be many more out there that you guys know, for example, mindfulness and things like that, but these are the 2 main types that are mentioned on the NHS website and are, as of known, the most popular types of treatment for OCD. So it starts with psychological therapy, which looks into cognitive behavioural therapy, and this uses exposure and response prevention therapy. So this looks at exposing yourself to this intrusive thought and kind of responding to it in a way that you wouldn't normally. For example, if you had a fear of germs, I know I keep talking about germs, but it's kind of like the most easiest one to explain, but there are lots of different types of obsessive compulsive disorder thoughts and compulsions. Anyways, back to germs. If you had a fear of germs, you would perhaps maybe touch something dirty like the lid of the bin, and for maybe 1 minute you just would not wash your hands, and you would have to sit and kind of just do calming strategies and techniques during that 1 minute, and then you'd be able to wash your hands. And you'd make an exposure therapy ladder and you go up and up and up. For example, you would get to 5 minutes without washing your hands, or you would only need to wash your hands once. And these sort of therapies are really, really good when you're in sort of like a good place. You're able to kind of sit with that feeling of discomfort and anxiety, and it really helps kind of when you make your own ladder and you can see how far you've gone with your achievements, and you need to be realistic. You cannot kind of set yourself a top goal at the bottom of the ladder and expect that you're going to climb mountains within days. These things take months, even years to kind of get over. Now, the second form of therapy, which is mentioned on the NHS website and which is commonly used, is medication. Now, this is my personal opinion. I believe medication is great. It might be good for some people, but I think it is great when used in conjunction with some sort of psychological therapy. I think the two work hand in hand perfectly. Sometimes medication isn't for everyone. It doesn't have the nicest of side effects. But for example, when I was kind of in a really bad place with OCD and I just couldn't think clearly, I just felt like I had a cloud in my brain. I literally could not carry on with exposure therapy, let alone kind of be a normal functioning human being. I needed that medication to take me to that point where I could continue on with my exposure therapy. So I think medication's great when it helps you to get to that point where you can do exposure and when you do have a clear mind, but it isn't for everyone, and I completely understand that. And some people are just better off just doing psychological therapies as well. And you can either do both, or one or the other, or none, and find an alternative form of therapy as well. So the common medications used to treat OCD is selectin serotonin reuptake inhibitors, which are known as SSRIs, and can help improve the symptoms of OCD by increasing the level of serotonin in your brain. So you may need to take this medication for 6 to 12 weeks before it kicks in, which is a big pain in the butt, really, because when you take medication like a paracetamol, you just want it to kick in immediately, but no, it does take a while to kind of get into the bloodstream and to work its magic. So most people require treatment for at least a year when they're on medications. You may be able to stop them, but do not just kind of stop taking them. It needs to be a gradual decline, so going from 40 milligrams to 20 milligrams, etc, etc. So for the last bit of the video, I thought I'd just kind of go through some of the myths of OCD. People make so many jokes about OCD, and people don't realise actually how crippling it is of a mental illness. It really is horrible, and I just want to kind of talk about some of the myths that are out there, otherwise they'll never get addressed. So one of the first myths is that people with OCD are always neat and organised. Now, from a personal experience, I have OCD and I'm incredibly messy. So you can have OCD and be completely messy or be neat and organised, but it does not mean it's got anything to do with your OCD. It's just the kind of person you are. So the second myth about OCD is that people think it's literally just about cleaning or about having things in order, like in the rainbow order, colours of the rainbow and things like that, and it is not. OCD has such a wide span of intrusive thoughts and obsessions and compulsions, and as I've said earlier, I could literally go on forever talking about it. Some examples are intrusive thoughts about harming a loved one. Of course, there is cleaning, things about bad luck or bad things happening to them, fears of getting ill, etc, etc. There's just so many obsessions, and it is I promise you, it's just not about cleaning or about keeping things in order. That might be the case for some people, but it isn't the case for many people that suffer with OCD, and many of the obsessions are very specific to that person. It's not kind of like something that everyone would be suffering with. It'd be very specific to that person. So one of the last common myths about OCD is that people can think that you can just stop if you wanted to. When I was going through really bad bouts of OCD, people used to say to me, either you can let it control you or you can control it. And it is much harder than that. When you give something such meaning and you're in this kind of vicious cycle, it's so hard to just stop. So please, 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 if you know anyone or have any friends suffering from OCD, don't just tell them to stop, because it is much more complex than that. And just be there for them and just support them and just kind of listen to what they're going through. And if they need a helping hand, just offer that helping hand, but just do not tell them that they can just stop, because I promise you right now, you just can't. It's a long journey and it takes lots of help, and you can't just stop when you feel like it. So I hope you guys really enjoyed this video and that you got something out of this, I hope anyways, and that you've learned a bit about OCD. Again, if you'd like more in-depth videos about specific compulsions and specific topics of obsessions, let me know by giving this video a like. And if you have any questions, maybe you think you have OCD or you're struggling with a certain aspect of your OCD, just let me know in the comments down below, or if you'd like it to be personal, just give me a DM on any of my social media sites that I'll be linking down below. And again, if you've got any tips for OCD, please, please, please link them in the comments so that we can just kind of help everyone as one big kind of YouTube family, and that we can all be there to support each other. So I hope you guys enjoyed the video, and I'll be back next week with another one.